Okay, so let's start with this scenario. I want you all to pause the video and note down the important points in this scenario which you consider are going to help you in diagnosis, and also try to come up, at least try to come up with investigations you would like to go for this baby and how will you treat the baby. Okay, so just pause the video, take your time, and after that continue with the discussion. Okay, so let's have a look at, oh, you just saw the name of the disease. Okay, let's just have a look. So this is a newborn and the child has uneven gluteal folds. So the first important point is the age of the baby. It's a newborn baby and the finding is uneven gluteal folds. And then when we examine the baby, we realize that the hip joint can be easily dislocated with a jerk and a click. What is this? This jerk and a click test that we do in physical examination is known as the Barlow and Ortolani test. I will just explain this, okay? This is a very important test. And okay, so it is dislocated with a sound of a click, and then it is easily returned back to the normal position with the sound of a snap. And the family is concerned because the previous child has the same problem. This disease actually runs in families. So these are all the points. Now let's just discuss this case. Okay, so as we just saw in the case that there was a newborn and the newborn had uneven gluteal folds. Okay, this is a typical scenario of development dysplasia of hip. This is also known as congenital dysplasia of hip, and we abbreviate it as DDH. So what happens? As we know that the problem is with the hip joint. Okay, so as we know that hip joint is a ball and socket joint, right? So this is the femur bone and this is the socket that we have, and this is the head, or let's just say that the ball of the femur bone. So the problem is actually that this socket, the ball is fine, but this socket is underdeveloped. Let's say over here it is like this, but in case of development dysplasia of hip, it becomes like this. It becomes very shallow, and this is the head again. So what happens is that this head can now not fix and not properly articulate with this shallow underdeveloped cavity. So if someone asks you that why is this disease happening, the cause is that the head of the femur is almost the ball of this bone femur or the head is almost normally developed, but the problem is with this acetabular cavity, it is shallow, it is underdeveloped. So because of this head slips. Okay, if this is a shallow cavity and this is the head, so it just continuously slips. Otherwise, if it was deeper, it would have fixed properly, but now it keeps on slipping and it keeps on dislocating. Okay, and because of this the hip dislocates and the gluteal fold is at a different position of the dislocated hip as compared to the normal hip joint. So that's why uneven gluteal folds are present, or you can say extra high crease of the gluteal folds. And the child can also not abduct the leg, but that is not something you are going to notice in a newborn. How are you going to notice these things? Yeah, there are special tests which we are going to discuss. And in an older child there's pain after exercise and limp, but the main thing is uneven gluteal fold on examination. Now let's just in the scenario that we just looked at, there was this thing about snapping and clicking. Okay, let's just talk about it. So basically what happens is that, let's just say this is the baby. Okay, so these are the legs. So what happens is that every newborn, this is something you should know in the neonatal examination. You have to do this test. This is known as the Barlow and Ortolani test. I'm just going to explain this. Okay, how to remember this, and let me explain this. So basically B comes before O. So we have to do Barlow first and then we do Ortolani. So in Barlow, what we do is that we adduct the legs. We bring them closer and apply downward pressure. When we do this, these are the legs. We adduct them and apply downward pressure posteriorly. We hear a sound. Okay, we hear a click, just like this click, and when the doctor hears this click, the doctor knows that now the hip joint has been dislocated posteriorly. Now what the this shows that this is not normal. Okay, this does not occur in a normally developed. If this cavity is normally developed, this click sound will not be there, dislocation will not occur on Barlow test. But now click happens. Are you going to leave the baby? No, now you have to fix the joint also. You have checked for the unbalanced state of the joint. Now you're going to do is that after adducting and applying posterior pressure, you are going to abduct. And when you're going to abduct and just kind of push it, the ball is going to go back into the socket. Okay, but it is easily dislocatable, right? So basically, this when you fix it back, when you adduct it, when you abduct it, adduction was for dislocation. That was Barlow. In ortolani, you do the opposite. You abduct it. You take them away and you try to put it back into the socket. You hear a snapping sound. Okay, so a click and a snap, and this is known as the ortolani test. So what is Barlow? Barlow is when you adduct the hips, adduct them and dislocate the joint and hear a snap, and then this shows that okay, this joint is unstable. So you're like, okay, this can be congenital dysplasia of the hip. Now you're not going to send a baby home like this, dislocated hip ke saath to aap usko wapas mummy ko nahi pakda doge uski. So what you're going to do is that you're going to now you're gonna now abduct it and now fix it. This is known as the ortolani. So Barlow is when you do adduction. I'm just gonna write it down. Barlow is when you do adduction, and ortolani is when you do abduction. And this is when you dislocate, and this is when you fix it back. So first you do this, okay, then you do ortolani. So this two-step procedure is basically the test that you are going to do in a neonatal examination. Okay, this is performed. Now what else is going to be there? That the limb is going to have extra high crease now. So when if you don't treat it earlier, the limb which is affected is going to be shorter, and this shorter limb or this high crease, this is known as a sign. Just remember the name, not that important. This is known as Galeazzi sign, Galeazzi's or Alice sign. Okay, so this uneven legs, this is known as Galeazzi or Alice sign. Okay, so we have talked about the history. We have discussed the test that we do, which is known as the Barlow and Ortolani test. Now, what is the investigation? Any child who has any any student who hasn't discussed this topic would go X-ray karalo. Wrong answer. Okay, why? Because at birth, the head of the femur and the acetabulum, they are not ossified. Okay, so what are you going to see on X-ray? Nothing is going to be shown. So what is the investigation of choice? The investigation of choice for DDH is ultrasound. Okay, and this ultrasound basically is usually done at 6 weeks, usually when the parents notice that okay, there's something wrong. But until 6 months you can do this. Okay, until 6 months you are going to diagnose this with an ultrasound. Okay, now you can also do an MRI, but that is not important. The main investigation is ultrasound. Until the child is less than 6 months, you're going to do an ultrasound. Now how are you going to treat? So the case that we were discussing was of a newborn. So if a baby is born and we know that the acetabulum is shallow and this ball of the femur, of the head of the femur is slipping again and again, what are you going to do? You're going to just fix them and give them some time. Within 6 months, this becomes deeper and properly developed. The remaining part, the underdeveloped portion, becomes developed, and this becomes normal. So you are just going to wait. Fix it in a position and wait. So how are you going to do this? The baby is going to move all the time. How are you going to fix the baby's leg? You're going to use something which is known as a Pavlik harness. Okay, a Pavlik harness is what you're going to use. Doger has shown the picture of Pavlik harness, but I think has not labeled it. I hope this is visible. This is a yes, too much magnification. Okay, no, this is okay. So as you can see, this is a Pavlik harness. What can you see here? The legs are actually abducted, and the knees are flexed, and the hips are also flexed, and they are fixed in this position by the help of this whole support. This is known as a Pavlik harness. Okay, so this is a Pavlik harness. This is also OSPI station, maybe they ask about you what is this Pavlik harness is used, but there's a limit. You cannot use this for any age. In a newborn, you can use a Pavlik harness, and it allows the head and the acetabulum to stay in a place and gives time for acetabulum to develop. So this is a conservative treatment, right? Now, let's say that this fails, okay, and the parents come at a later stage. So what you're going to do now, you're going to do open reduction, okay, and in toddler and children you have to do open reduction with bony realignment, okay, but this open reduction surgery is carried out after 1 year of age, and after 6 years of age, you should know, until 6 months, what was the investigation? Ultrasound, and it was usually done at 6 weeks. And once the baby is not a baby anymore, once the child has reached a 6 years milestone, now you cannot do anything. Okay, so let's just discuss our treatment algorithm. So almost until 1 to 6 months, you are going to treat it, conservatively with the Pavlik harness. Okay. And after that, what are you, or after, if this fails, well, usually it does not fail, but let's say that it fails, you're going to go for open reduction. You're going to do a surgery and, open it and, reduce the bone, fix it. There's basically a risk of, avascular necrosis of the head of the femur. So, the thing is that while applying the pelvic harness, we are going to, abduct the legs as we just saw in the diagram. But do not, while doing this, do not over abduct, avoid wide abduction. Because if you, wide abduction, and if you do excessive abduction and force internal rotation, what is going to be there's going to be avascular necrosis of femur head. Okay, all of these things are not mentioned in the book, but let's just keep in your mind is Pavlik harness and Barlow and Ortolani tests. And yeah, these are the two main things, and the investigation, that is ultrasound until 6 months.